How to treat and cure endometriosis. Every woman needs to know and understand the basics about endometriosis. This insight can offer a way to better see how our bodies work, and what we can do to keep ourselves healthy. The diagnosis of endometriosis can be scary, but let's look at why we at Women to Women feel it may not be so. Endometriosis has been on the increase, and there is debate about why. We suspect that the high estrogen levels in women and increasing number of women with autoimmune disorders are a contributing factor. It also often runs in families. And we know from clinical experience that emotional issues are often involved. But in all these causes we find the theme of hormonal imbalance. And the good news is that we can usually do something about that, without drugs or surgery, and usually see great improvement. Endometriosis, sometimes misspelled endometriosis, is an outgrowth of the normal menstrual cycle. Each month the tissue inside the uterus, the endometrium, thickens as it intends to support a fertilized egg during pregnancy. If the egg is not fertilized and the woman does not become pregnant, then the uterus sloughs off the lining with the onset of her period. This is the bleeding that occurs during your monthly period. It is usually a healthy sign and a normal process of being a mature woman. Symptoms of endometriosis. It is not easy to diagnose endometriosis. Some of the symptoms, such as chronic pelvic pain, menstrual pain, bloating, painful sex, or pelvic discomfort between ovulation and your period, do provide a suspicion that a woman has this disease, but it is not a conclusive diagnosis. Notably, some women have the condition without symptoms, while others have the same symptoms but no endometriosis. Tests and diagnosis. Pelvic exam. During a pelvic exam, your doctor manually feels, palpates, areas in your pelvis for abnormalities, such as cysts on your reproductive organs or scars behind your uterus. Ultrasound. This test uses high-frequency sound waves to create images of the inside of your body. To capture the images, a device called a transducer is either pressed against your abdominal skin or inserted into your vagina. Transvaginal ultrasound. Laparoscopy. Medical management is usually tried first. But to be certain you have endometriosis, your doctor may refer you to a surgeon to look inside your abdomen for signs of endometriosis using a surgical procedure called laparoscopy. Treatment for endometriosis is usually with medications or surgery. The approach you and your doctor choose will depend on the severity of your signs and symptoms and whether you hope to become pregnant. Generally, doctors recommend trying conservative treatment approaches first, opting for surgery as a last resort. 1. Pain medications. 2. Hormone therapy. Hormone therapy. Supplemental hormones are sometimes effective in reducing or eliminating the pain of endometriosis. That's because the rise and fall of hormones during the menstrual cycle causes endometrial implants to thicken, break down and bleed. Hormone medication may slow the growth and prevent new implants of endometrial tissue. However, hormonal therapy isn't a permanent fix for endometriosis. It's possible that you could experience a recurrence of your symptoms after stopping treatment. Hormonal therapies used to treat endometriosis include hormonal contraceptives. Birth control pills, patches and vaginal rings help control the hormones responsible for the buildup of endometrial tissue each month. Most women have lighter and shorter menstrual flow when they're using a hormonal contraceptive. Using hormonal contraceptives, especially continuous cycle regimens, may reduce or eliminate the pain of mild to moderate endometriosis. Conservative surgery. If you have endometriosis and are trying to become pregnant, surgery to remove as much endometriosis as possible while preserving your uterus and ovaries, conservative surgery, may increase your chances of success. If you have severe pain from endometriosis, you may also benefit from surgery, however, endometriosis and pain may return. Assisted reproductive technologies. Hysterectomy. In severe cases of endometriosis, surgery to remove the uterus and cervix, total hysterectomy, as well as both ovaries may be the best treatment. Treatments for pain from endometriosis. Treatments for endometriosis pain fall into three general categories: pain medications, hormone therapy, surgical treatment. Pain medications may work well if your pain or other symptoms are mild. These medications range from over-the-counter pain relievers to strong prescription pain relievers. Hormone treatments. Because hormones cause endometriosis patches to go through a cycle similar to the menstrual cycle, hormones also can be effective in treating the symptoms of endometriosis. Additionally, our perception of pain may be altered by different hormones. Oral contraceptives, or birth control pills. These help make your period lighter, more regular, and shorter. Women-prescribed contraceptives also report relief from pain. Progesterone and progestin, taken as a pill, by injection, or through an intrauterine device, IUD, improve symptoms by reducing a woman's period or stopping it completely. This also prevents pregnancy. Gonadotropin-releasing hormone, GnRH, agonists, pronounced agonists, stop the production of certain hormones to prevent ovulation, menstruation, and the growth of endometriosis. This treatment sends the body into a menopausal state. Treatments for infertility related to endometriosis. If pregnancy does not occur after laparoscopic treatment, in vitro fertilization, IVF, may be the best option to improve fertility. Taking any other hormonal therapy usually used for endometriosis-associated pain will only suppress ovulation and delay pregnancy.